Hi, I'm Dr. Daniel Cukor, the Director of Behavioral Health here at the Rogosin Institute. And in this video, I'm going to go through some of the content in the magazine devoted to reconnecting for this year's May's Mental Wellness Month. The purpose of talking about this is so that you can do an inventory for yourself to know what things you should be working on and then provide some particular strategies for perhaps how to get your needs met. So first, let's talk about some definitions. So here you can see that an objective state of just not having enough connections in the world, we can describe that as being isolated or alone. There just aren't enough people that you come in contact with on a regular day. And on the emotional side of that, we call that loneliness. The feeling of just that there aren't enough people that you're speaking to or interacting with. And the opposite of all of that is what we call connected. It's this subjective and objective experience of being satisfied with the number of people that you have in your life and the quality of those interactions. So social scientists have described that there's different types of support that we actually all need to feel our best and to have our mood be as strong as it can be. And here you can see that there's different types of support are described as emotional support, informational support, instrumental support, and companionship support. So the first one, emotional support, is the one that we often will think about when we say, do you have enough people in your life? Like, who do you turn to when you're feeling lonely, when you want to have a deep, meaningful conversation? If you're feeling vulnerable about something, who can you turn to really have a deep, connected conversation? There's other types of support as well. So for example, informational support is who do you turn to for advice on how to handle a particular problem, whether it's your health or any other decision that you need to make. Who are the trusted people that you can turn to get their advice and input about how you should proceed? And there's instrumental support. This is not really about talking. It's really about, something practical or pragmatic. If you need a ride somewhere, who could you turn to and ask? If you need to borrow some money, who are the people that you could ask for help? And the last category is what we call companionship support. If you just want to have fun with somebody, go out, do something. It doesn't have to be someone that you, are connected with on a very deep emotional level, just people to go have fun with. And we need all these types of support in our lives to really feel connected. So if you find that you're thinking about your life, and in particular, coming out of all the social distancing associated with COVID, that we've missed out on some of these opportunities or that we're missing some of these areas in our lives, here are some practical suggestions about different ways that we can reconnect. So the first one is really to just get involved in something or anything, your library, senior center, house of worship, do some advocacy work, whatever you can think of. Being in a group of like-minded people can be very invigorating. And instead of feeling like there's not much to do in a particular day, you can be called to action, and there'll be lots of things that you can be involved with or projects to get involved in. And that really helps us feel connected to one another and helps us feel like we're part of something larger. And if you can't do that in person, there are online resources that you could join, online communities, either on the internet or through social media, that perhaps you can connect with, and that will help you feel more connected to these other people. Really develop a sense of community through these online resources. A suggestion that I receive from patients is that they've begun to turn to their extended family as their support system and network. They didn't feel quite comfortable reaching out to all of their old peers, but with an aunt, a nephew, a niece, a brother or a cousin, just people that perhaps they've begin to fallen off having contact with over the past 2 years, just to reach out to them and to just begin to foster those relationships again can be really rewarding. If you'd like to do something more related to kidney advocacy, so there are opportunities here at Rogosin. The National Kidney Foundation has a program. The American Kidney Fund also has a really nice volunteer program. You can check out their websites and see if you want to get involved. And then perhaps just doing something physical, getting out and going for a walk with a neighbor, going to the gym if you're feeling up to it, or even going to physical therapy if that sounds like a good idea for you. Just something to do and get out and be with other people and do something. So as I've been talking with people, a lot of people have had some hesitancy about kind of returning to their social networks, to their former communities. It just doesn't feel as perhaps as safe, or I don't know, they're out of practice. So the first step to that, I think, is to have a conversation with your medical provider and decide really what is the appropriate amount of social interaction that you can have now and how can you do it safely. For most people, having no social interaction is really a very bad idea, right? It can lead us down some bad paths. We just don't feel good unless we're connected with other people. So even if it can't be in person, finding some virtual or online ways of connecting with people seems to be essential. But what I've been noticing is that even sometimes with the encouragement of the healthcare team, people are still a little hesitant. They just don't feel that they're quite ready to do it yet. And I describe that as something called emotional reasoning. And that means like, I'm not going to, I've decided to do something because it doesn't feel right to me. And often we are told to kind of trust our judgment and to trust our gut about when something is dangerous or not. But here, I think it's worth pausing for a moment and being a little intentional about whether this really is something which is dangerous or not, and deciding for ourselves, whether we really feel like whatever activity we're considering doing is too risky, or whether it seems like it would be something which is safe. Because sometimes when we're doing kind of this difficult math of figuring out what amount of risk we would like to take, we discount the fact that having no social contacts can really be very unhelpful and unhealthy for us. So I encourage everyone to kind of think about the different types of support that are missing from their lives, to develop a strategy for trying to fill in some of the parts that might be missing. And if you're feeling a little hesitant about doing it, kind of take a moment and really do an inventory for yourself and think about whether this is something that you really would like to do and are just having some cold feet around it. Good luck.